Hi, everybody. Thank you so much for joining us. This is a biannual Tapping Out a Trauma webinar series on all kinds of aspects regarding trauma and working with trauma. And we have a really special guest today that I'd like to invite. And of course, Suzanne Fagel is my partner.
Folks.
And new to probably all of you will be Dr. Jennifer Levin. And Dr. Levin, Jennifer, specializes in working with adolescents and teens and adults, and especially ones that are experiencing traumatic grief. And that's going to really be the topic of our discussion today. Traumatic grief and the sudden loss associated with that. In 2000, Jennifer received her doctorate from UCLA School of Public Health, her master's in clinical psych from Pepperdine. She's a recognized fellow in something called thanatology, right? That's the study of death and dying and bereavement. She served as executive director of hospice in Pasadena. She's taught at several California universities. She's a licensed marriage and family therapist in both California and here in Washington on Whidbey Island. This is actually the first time that we've had myself and Suzanne and a guest all from Whidbey Island, maybe second, but anyway, it's pretty rare. She specializes in working with clients that are living with chronic and terminal illness and sudden death, and of course, post-traumatic growth, which everybody should be well aware of here. In 2018, she launched her online program From Grief to Growth, as well as Growing After Traumatic Loss. It's an online self-help course for individuals living with a sudden, unexpected loss. She's also the host of a podcast called Untethered, Healing the Pain from Sudden Death. So, after all that, I think that you are duly qualified to be talking about trauma and loss and grief. And so welcome, Jennifer. It's great to have you here.
Thank you. I'm very excited to be here with you both today.
Yeah,
Thanks. So Jennifer, I'm going to start the ball rolling by asking you, clearly you were drawn professionally to work with those dealing with death and grief. We're intrigued by what drew you specifically into the world of traumatic grief. If you'd tell us a little bit about that journey.
Sure, absolutely. Well, I actually think this population found me. Like you said, I was in grief and loss, and I had a long history in end of life care. And all of a sudden, I just had this influx of clients who had experienced these traumatic and sudden losses. And most of them were pretty young, in their 20s, 30s, and 40s. And they had loved ones, husbands, wives, partners, close family members who died in a really traumatic way. And at that time, I was seeing everyone in person. This was long before COVID. And there were really no resources for them. And there were no resources that really combined both how to live and address with the trauma that they were experiencing and the grief. And so I just saw this huge need and started to develop a program or a combination of services that both did trauma and grief. And I remember probably about 7 years ago, I launched my very first traumatic grief therapy group, and it filled right away, and that was kind of the beginning of it.
Okay, and that makes sense. And I think many of the people here listening have found themselves drawn to, called to, this is what's showing up for me. So I guess I'll follow that. So I love that. I'm wondering to just set a foundation here, because I think sometimes, those that aren't experiencing grief, like grief is grief, but grief is not just grief. There's many different types of that. So maybe you could just start off beginning with describing for us some different types of grief, especially ones that you work with, and maybe a little bit more about what makes traumatic grief, the relationship to that, distinct from some of the others, and just begin maybe laying the groundwork for this discussion.
Sure. I remember the first time I went to a grief training, and there was a slide of all the different types of grief, and there must have been like 20 of them. And I was like, oh my goodness, I had no idea. And so if I can, just give you 3 different categories right now. So there's anticipatory grief, which is like when you're watching somebody die and there's all these mini deaths that you experience as somebody is preparing to die. So caregivers are going through that as you're anticipating the loss. And then there is an expected loss when we know somebody is dying. No, excuse me. Yeah, then an expected loss. Someone's dying for cancer, heart disease, pulmonary problems, whatever. So we expect that it's going to happen. And then there is an unexpected or a sudden death or a traumatic loss, which is I do. Okay, so if you think about those as the 3 general types of grief. And then there are things now that you see like prolonged grief disorder, which is actually brand new in the DSM. I'll talk a little bit more about that later on. And there's things like cumulative grief, where you have loss after loss after loss. There's things like ambiguous grief, where you get no emotional closure. There's things like disenfranchised grief, where your grief isn't recognized by other people. So let's say you're in a relationship with someone, maybe you're not married, the partner dies, the family comes in, swoops in from out of town, doesn't acknowledge you at all.
Yeah.
And you get none of the benefits of being acknowledged as the partner or the rights by society as being the partner. And so you have what's called disenfranchised grief. So there's all these different types of grief. But today we're really talking about traumatic grief.
Right.
Traumatic grief happens when somebody dies in a sudden or unexpected way, but it's in a traumatic way. And so most of my clients have experienced death of a loved one by suicide, by homicide, by a substance abuse or substance problem, alcohol or overdose, a medical crisis. One moment they're okay, and then the next minute, something happened and they're not. A natural disaster. COVID certainly fell under that, especially the circumstances of not being able to say goodbye. Right. But what makes a traumatic death so different is, you're not able to say goodbye. Oftentimes it's very violent to the individual who dies. The individual, the loved one who's left behind, many times they're at risk or could have been in harm's way. They witnessed it themselves, or they came home or to an event and saw what happened, or they found out in a bad way. It's usually untimely. In many cases, it could have been prevented. So then you get all of these, I should have, I could have, I would have, or what if. There's a tremendous amount of uncertainty, unanswered questions, which just gets the mind going in so many ways, with rumination and wondering. So there's so many different factors that happened. So clients are experiencing things like hypervigilant, always on alert, constantly of, what's going to happen next, waiting for the other shoe to drop. I talked about ruminations, flashbacks very often. There's huge dysregulation of emotions that come with a traumatic loss and traumatic grief. And then we haven't even talked about grieving the loss of the loved one, because there's so much trauma that many of the clients or the people that I work with and the individuals that are listening to the podcast or that you're training that would be working in the field of traumatic grief as well, that it's like mental gymnastics that is going on in the mind that you've got to be able to tame before we can even get to the grief and processing what has happened, because it's just so surreal, especially in the early stages. So I don't know if that's the brief snapshot you're looking for there.
Suzanne, you need
That's
to
good.
unmute
And
yourself.
along with that, it seems that one of the possibilities that people can get caught up in is depression. And so, like, how would you distinguish grief from depression?
Yeah. It's a really great question, because in the beginning, so you've got the trauma, which is usually a heightened state and resembles more of an anxiety state. And I mentioned the dysregulated emotions. So you go from this intense anxiety to this real low, which can look a lot like depression. And so you get things, especially early on, that really mirror depression. You get things like a withdrawal and an isolation and wanting to be on your own, and a disconnection from the world, not wanting to participate in anything. You get issues with, not sleeping right, not eating right, loss of pleasure in any activities. And those are all things that mirror depression. And if you look at the DSM, it's asking you, in the last 2 weeks, have you experienced any of these symptoms, which are going to say, yes. And so it's going to mirror very, very much the sadness, loss of pleasure, turning within, changing in daily activities, sleep, decrease in appetite, increase in appetite, things like that. But where you get a difference in depression is that when an individual is grieving, there's going to be intermittent breaks where they're going to be able to reminisce. They're going to be able to laugh about, oh yeah, I remember that time. Now, in traumatic grief, sometimes it doesn't happen immediately in those acute stages. There's like that shock and numbness and just like, I don't even know what side is up. But, you are able, the loss of self-esteem usually isn't present that you would see in depression. You're still able to connect and, engage with other people, which people with depression aren't able to do as well. A lot of times initially, some of my clients aren't functional. They aren't able to get out of bed. It just feels like, life is over for them. So it does look like depression early on, but there are still moments when they're able to connect to some of those good memories or look at earlier pictures in life. People have a really hard time looking at the pictures that are yesterday or when, their loved one looks like their loved one. But you can go back to some of those earlier things where someone who's depressed, they can't see anything and smile. And again, that's more in the severe depression. But they can usually still reminisce about the good times that happened with grief.
I'm wondering, thank you for that. And I'm also wondering about the triggers. You started to kind of hint into that. And for somebody, I mean, I almost want to back up for a second. Of course, people
Yeah.
always think about how long should they grieve for? What's the right amount of time? Does grief last for a month or a year or a lifetime with that? I'm wondering, so maybe in this, you can talk about both the timing of grieving with traumatic grief and also trigger, because even if it kind of comes down, then there are other things that are going to make it's not just done necessarily. Yeah. So maybe you could talk about timing with triggers and duration and some of those things.
Yeah. Well, most people will tell you that, especially in a traumatic grief, that it doesn't end, that it lasts forever. And a lot of people will tell you that with regular grief. I mean, it's not something you ever really, how do you get over the loss of somebody you love? And, the goals in terms of grief therapy when I'm working with a client is like integration and being able to hold your loved one in such a space that you can continue to move forward with your life. You never move on, you never completely heal. And I'll get to your question, but just so you know what that looks like. But most people will say it's a lifelong sentence. And I don't say that to be negative, but to be what's realistic. Are you in the acute pain forever? Absolutely not. And I find myself saying things like, it's not always going to feel this intense. You're not always going to be in this place. It does get better. It gets so much more manageable. It changes. It evolves. Now, there are triggers. And over time, the triggers lessen. There's more time in between them, and you get more skilled at handling them. So a trigger is any event that just sets you off. You know, it just sets off your grief. And there are, I like to categorize them into two different types. There's both expected, like, oh my goodness, my loved one's birthday is tomorrow. Our anniversary is this. Our special day, we just went through the holiday season. That was a trigger. So the expected triggers are things that you know, this is going to be hard for me. And we spend so much time anticipating these expected triggers. People get really, really, really nervous. The good news is usually there's a lot of relief after those expected triggers are done. The hardest ones are the unexpected triggers. Like when you're driving in a car and you pass a billboard that reminds you of something, or you walk into the market and they're playing your favorite song or your loved one's favorite song that evokes these memories. So there's expected and unexpected. The unexpected, there's no anticipation for, but the fallback is usually harder to recover from. Versus there's lots of anticipation for the expected, but usually when it's over, you feel so much better. So, but like I said, the unexpected, they could just be sense, a smell, anything that just evokes a powerful memory for you. So, yeah.
Thank you. Thank you. So I've heard this term, and I'm wondering if you could tell us, what is a grief attack? And maybe you could give us an example of what that
Absolutely.
Okay.
Yeah. So a grief attack can be look a lot like what happens after you experience a trigger, but it doesn't take a trigger to have a grief attack. And let me elaborate a little bit more. So you can just be in the market or at home or out with friends, and then out of nowhere, just this huge, and a lot of clients describe it as this tsunami, this wave, this intense feeling of grief just overcomes you out of nowhere. And it shows up differently for everybody, depending on how they experience emotions. It may look like panic for some people, like they're having a panic attack. For other people, it's a wave of just emotions and crying, a huge wave of sadness, but it's this huge experience of grief emotions. And when you work with your client, it's knowing how they express their emotions. Like, what does grief look like for you? And it's that on steroids would be a grief attack. And again, it can be either a trigger that causes it or nothing, but it's a grief attack of just huge grief emotions. I think for some of my clients who get really, really anxious and experience these dysregulated emotions during a grief attack, an example I have for them, or a coping tool that works really well, is a frozen orange. Is to go into the freezer, grab an orange, hold it, focus on the cold, the texture, feeling it, thinking about it, getting out of your head, and the emotions, and just using the weight of the orange, the cold, just to help calm down, focus on the breathing. Obviously, with tapping, you would use a very different skill. The same goal being to get through the emotions that you're experiencing at that particular moment.
Well, I just want to say not necessarily, because if somebody is that dysregulated, we also have other ways of saying, you know, before you get them back into a regulated state. So I like adding frozen orange as an option.
Okay.
Thanks.
Yes. Yeah, I used to joke with people, I do not get a kickback from Dole the fruit company, because I think half of my clients now have a freezer full of oranges. So it's a great
And,
technique.
and I like that idea of orange or whatever is going to work for that person to
Yes,
regulate them and bring them present in the moment.
yes,
Right? You
yeah,
know, it's not a point to go deeply into the experiencing all the emotions in that moment. And I don't want to say it's necessarily to distract, but distraction sometimes is useful.
mhm,
Simply tapping silently to just start to bring in a more dorsal vagal response, to be able
yep,
to do a more ventral vagal response, so that we can start to find a way to regulate our system, whatever works for you, and give our clients a variety of options. So
yes,
that's important. So basically, you know, I think of it as a panic attack that's grief driven,
yes,
you know,
absolutely.
that people might relate to that way. Yeah.
Yes, absolutely. Or a grounding exercise with your senses, whatever you need to do to bring yourself, to Dan Siegel's term, back into the window of tolerance.
Right, exactly.
Yeah.
So I like to look at patterns without them being stereotypical, but
Hmm.
yet they're still patterns, right?
Hmm.
In other words, so I'm just wondering if we could explore you know, we'll look more from the kind of practitioner side, but for a moment, as we look through the idea of what are the patterns that we might start to recognize, somebody that isn't, I don't want to say grief informed. They don't have a lot of background specifically in grief, but they have seen, let's say, a number of clients that have had traumatic loss, or for themselves or in their clients. And I'm wondering about some of the patterns that we might see about either return toward normalcy, stages that, you know, I'm not going to say, you know, I don't know if you want to address the Kubler-Ross stages and how that's evolved, but however you want to look at the patterns that people could see and maybe to normalize some of those patterns for them.
Sure. I think the first biggest pattern that I see is a lack of safety or a fear that clients experience in the world, that something else is going to happen again to them or their loved ones. And actually, in one of my podcast episodes, I talk about the theory of shattered assumptions by Ronnie Janoff Bullman. And this is a fantastic theory that we have, according to her, there's 3 or 4 tenets that we build our life around, that we live in this world that is predictable and a very safe world. We work hard, we're going to be rewarded. And she just explains it beautifully. Then when you experience a traumatic event, this is shattered and your world is no longer a safe place. And that's what happens after a sudden loss. And so I have clients that are afraid to drive, to leave their house, who become helicopter parents, who panic when their kids don't call or their loved ones don't answer the phone. And so that's the first pattern I see, is this huge hypervigilance, waiting for the other shoe to drop. The world is no longer safe. I did on exercise with some of my clients. What are your hopes for 2023? Why should I hope for anything? Because it's just going to get taken away from me. So I think that's the first big pattern. Why bother? You know? So that's the first thing that I see. The second theme that I see that goes through is nobody understands what I'm going through. And that is because my loss is so different. So clients will say, if one more person says, yeah, I know what you mean, my grandma died last year. You know, they came home and they found their loved one, you know, had taken their life, had a medical crisis, was, you know, a victim of a homicide, and it's compared to grandma who died peacefully in their sleep. They feel so misunderstood. That, and then kind of connected to that is they feel like people don't want to talk about it, or I rephrase it as they don't know how to talk about it. So their pain's not understood, and they don't know how to talk about it. And so to help listeners, just being able to sit and witness it, hear it, and validate it is such a powerful, powerful tool. That's such a gift that we can give to people, is to be able to hold that space. Because not a lot of people can. So huge pattern. And then I think the third thing that I see so often is clients desire, and I even would say need, to hold on to their pain or grief as a way to remain connected to their loved ones. And the fear, wait a minute, if I experience pleasure or joy, if I start to feel better, I'm losing my connection, or it's not fair because of what happened to my loved one. And so I look at my work at that time as helping people find a way to develop a continual bond, which is a big work right now, or it's been around since the 90s, the theories of continuing bonds. Strengthen their bond with their loved one in a positive way and not through pain. So connecting through positivity and evolving new relationships with their loved ones who are absent in other ways besides pain. So those are three really, really big themes.
Yeah,
Thank you.
very good. Jennifer, can you say again the name of the person who has the shattered?
Theory of shattered assumptions. I always feel like I mispronounce her name. Ronnie Janoff Bullman, Bulman.
Okay, thank you. I just wanted to make sure people got that reference.
Yes. And I have like I said, I can't remember if it's my episode 3 or 4 of my podcast is all devoted to the theory of shattered assumptions in a sudden and unexpected death, because that's not everything it applies to, but yeah, it's just a brilliant, it's a brilliant theory.
Right, thank you.
Mm-hmm.
So now, what's the difference between working with an adult or a child who's suffered traumatic grief?
Oh my gosh, this is such a big question.
Sorry.
So I'll start off by saying it depends on the relationship of the person who died and the age of the child.
Okay.
So with that caveat, let me say that number one, children differ in their ability to conceptually understand the meaning of death. And I've done a lot of training on that. And I'll just say generally about the ages of 6 to 8, depending on the child, is when children develop a conceptual understanding of what it means to die. And there are 4 things that kids have to be able to understand. And I'm going to forget them if I try, but I will now. That it's universal, that all living things die, that there's a physical cause to death, something in our body doesn't work. It's irreversible. And I'm going to forget the 4th one. I knew it because I wasn't prepared for that. But there's 4 things that kids have to be able to get it. And it's really hard because in our cartoons and our movies, our characters come back to life, all of that type of stuff. But they have to be able to understand that things. Okay. Second, it's just classified in the literature. Whenever a parent dies, it's a traumatic death for a child. It's just labeled that way. Okay. So important to know that children grieve differently than adults. All right. Children go in and out of grief, where adults were just kind of in it. I've been in the room many times with families and kids when a child is told about the death of a parent. I was in the room with a mom who told her kids that must have been 7 and 10 that their father had killed himself. And the 7-year-old said, okay, are we still going to go camping this weekend? And that is exactly how kids think. So they go in and out, in and out. Parents panic and call all of the time is my child not grieving right? And we judge because we think our kids are supposed to grieve in a certain manner. They're supposed to go in and out and in and out. They're also very resilient by nature in terms of grief. Kids struggle more with milestones, birthdays, first days of school, father-daughter dances, things like that, where the parents, and I'm using parent as an example right now and not a grandparent because we could get into every scenario of the world, where the parental figure or the person is supposed to be there, whereas an adult might go, my loved one's been dead for 73 days. So we count time differently. I will say problems with grief, struggles with kids show up with problems with their friends. That's where you know a child is struggling, interactions with their friends, acting out problems, academic problems, engaging in risky behaviors is big. And you might see, obviously, alcohol, increased SI, suicidal ideations, and but it's very common for them to pull back from their family because that's especially as kids get older. So without very specific questions, that's about as good of a generalization as I can give you, because kids are just a whole phenomenon on their own, and it's really going to differ by age group.
Well, thanks, though. That's at least now we know what to look for. And yeah. So thanks.
Yeah, I do a lot of training on kids, so I'm happy to talk more about kids anytime. So.
Great, thank you. That was really important and some really, everything makes sense, but it's useful to hear kind of clustered together in an overview like that. And of course, they're always individual, but
yeah.
Let's actually move it more to the direction of the practitioner.
Okay.
Yeah. So I know that your experience, like your skill set, is not EFT, which many people listening are, and that's okay, because I think it's really important that we hear from different perspectives, not just from within our own universe, so to speak. So from your point of view, what should a practitioner's priorities be when working with somebody that's grieving? What are some of the tenets, whether you're doing CBT, EFT, TFT, whatever you're doing, still some of the tenets that a practitioner should strive for, including and integrating into their work when working with somebody that's dealing with traumatic grief?
Absolutely. Well, I think there's a lot of overlay. And the first thing is, number one, you just want to establish that safe relationship with your client, that safe space, that your grief is safe with me, non-judgmental, you can hold it. I've had clients come to me, and I used to supervise a team of clinicians who were getting their hours. And I had clinicians say that they've come to this space because their previous practitioner couldn't handle it, was crying or didn't know how to be with their grief. And so just like, yes, this is a safe space. And you know that, sometimes it's been shown treatment modality isn't as important as the relationship between the practitioner and the client. So just being there unconditionally on the relationship. Validating the pain and their story. I think I mentioned earlier, friends and family get tired so much sometimes about hearing about it. And I may hear the same thing over and over and over and over again. And it just needs to be said and expressed. That pain it just needs to keep coming and being a place to do that. I get so much things of like, oh my goodness, I think I'm going crazy. Oh my goodness, I think this is going on. And so being able to listen deeply, hear it, be okay with it, saying, no, you're not. Grief is so interesting because it's so unique, and yet there are commonalities. So everybody's experience is so different, and yet there are similarities, like, no, you're not crazy. No, this is okay. And so being able to just give that, no, this is okay. This is okay. And hear every story, and providing, I call it reflective listening, normalization, validation, all of that type of thing. And reassuring that what you're going through is okay. So providing psychoeducation when appropriate, they'll come in with questions. I do think if this is an area when you see yourself, like, I want to work with some grieving clients, it is beneficial to take a basic class or do some reading. If you're going to use some EFT and see grieving clients, you don't need to be an expert, but basic psychoeducation is good. Just knowing, grief is not an illness. It's a normal human experience. I do a lot of grief education to people so that they know some basic things. I mean, the techniques that we learn are what we study, but knowing basics about grief as a human experience, I think, is important. So.
Yeah, I'd like to just add, and Suzanne, just with you and I for a second, bringing in the tapping perspective from an EFT practitioner. Many of the things that you said are very useful to be able to anticipate or explain briefly the different types of triggers, for example, and normalizing. But ultimately, we have both EFT practitioners that are licensed and unlicensed. And you're speaking through the lens of a licensed practitioner. And for a coach or a non-mental health care provider, the information is still very useful to ask questions about, to inquire into. And I'd say one of the biggest things that needs to be discussed is what we call the secondary gain psychological reversals aspect, which is such an important piece of, if I tap away or I get rid of my grief, then somehow I'm going to lose the connection with this person. It's a huge fear that comes up, that this sadness, this grieving, this feelings of loss, that if I get rid of that, I will no longer, there's this break in connection that they fear might happen. Can you just maybe speak to that? Because I'm sure it's, you already mentioned it. And as a tapping practitioner, it's really important, because we're not tapping to make the grief go away. No. We're working with them to, given your grief, how can you still move through whatever it takes to connect with others, if that feels like something you desire, how to be able to move forward with that grief until it's no longer there. So I just want to, either Suzanne, if you want to offer something, or Jennifer, about that, just related to that. Anything else?
Well, I mean, that's it. And the goal is the same, to move forward and to put the grief in a place within yourself that doesn't stop you from moving forward, and that allows you to move forward in your life. And to that thing, though, I do think it's always very helpful, no matter what modality you're working with, to have a basic understanding of the foundations of grief. Mm-hmm. Because you need to kind of know what the territory looks like in order to be able to, first of all, get a good sense of maybe where we're going working with the client, and not to anticipate it or, put it on our brain. Now we have to work through this and this and this, but to at least be aware, so that when somebody says something, you can go, oh, okay, got it. Mm-hmm. And maybe this is something we need to explore a little further.
Yeah. So for those people who might be interested in learning more, the theory of continuing bonds is something I do a lot with, which is on taking the relationship that exists with your loved one and building it more. And so I have, for example, I have somebody who is building, there's a lot that's been done, especially with a parent-child relationship, and how that relationship continues or can continue to evolve in death. And so how you continue to maintain shared interests, and things. What can you do to strengthen that relationship? Or, so there's just, I mean, there are different things that you can do in terms of if you're interested in that, to read on that theory of continuing bonds. And so how do you take that negative, the pain you're experiencing, and work on through the EFT, decreasing that, but then what could you do to build positively with that relationship? So having some background on that would be for somebody who is interested in working with clients who are grieving, and giving them some information on, transforming their relationship in a new way.
That really goes to kind of my next question about those that are grieving. We'll just look at the time for a moment. It's one thing with somebody within the first year, let's say. But for those that are grieving and still really affecting their lives 10, 15, 20, 30 years later, how is that different? How do you work with that? And part of that might be transforming it into what you just said, which, I have thoughts, not on EFT, matrix reimprinting, of starting to see what would it look like to have a transformed relationship, but for whatever reason, they haven't been able to move through those stages. Anything that really has to do with those long-term grieving processes that you might address?
Well, so grief has absolutely no timeline. Absolutely. I mean, I have somebody who's just started treatment who experienced a death 5 years ago. And so there's, delayed grief, meaning like I've been focusing on the kids and I haven't gotten to my grief. And so I'm just now ready. And so if somebody's just now ready, I would start with what I just mentioned to you. You start with the relationship. You would do everything that we just talked about, because for 5 years, they have put their grief in a box and delayed it, repressed it, and something I always say, it's going to come and get you sooner or later, whether it be in a health problem or a relationship problem. Sooner or later, it's going to come and bite you. And so if someone's delayed or repressed it, you're going to start just like you would on day one. Then you have the people who have been in treatment and who are basically stuck, for lack of a better term, in their grief. And that's where that whole prolonged grief disorder is coming in. And that the DSM is now covering. And that can be because there were complications in the relationship or complications in the grief. And you're asking how would I work with that differently? Or let me just understand your question a little bit better. I think I lost you for a moment.
No, I mean, I think that what you're saying is not necessarily any differently. You're going to take with how they're presenting, and it's going to be as individual. I was just wondering if there was anything unique for something that's delayed, even just that you mentioned delayed grief, which could be months or years, because all I've been able to is focusing on getting the kids out of the house, and now I'm dealing with. So there are all different reasons that it could be prolonged.
Right.
That being one insight that's useful.
Well, usually when people are stuck, I find it's because there's a particular narrative that they are telling themselves, or a story that they're stuck on, or a belief that is causing them to be stuck. And it's usually pretty easy to identify what that is. But the difficult thing is to see if they're open to rewriting that narrative. I have a belief that it was all my fault that this happened. And is there room, or are they open to rewriting that, or to challenging it and believing something different? If there's no room, they're going to stay stuck. If there is room, and usually in a case like that, I will say, well, what if we looked at, would you be open to rewriting or looking at 5 different narratives and seeing if I can, well, I'm not saying your narrative is not the correct one, but could we maybe come up with 5 different other ways to look at it, just to see if we can open them to look at something different? But that's usually what's going on.
Okay. So along that same kind of idea, I guess, what might be some of the considerations or circumstances that would indicate the need for a referral to a professional who specializes in traumatic grief work? Now, for EFT people, partly that may be a difference between whether you're a coach or you're licensed and doing EFT. But what might show up in the client's original presentation or emerges during the work that would indicate the need for referral?
Yeah. Yeah. Well, first and foremost, is always like, suicidal ideation, self-harm, high risk behaviors, just like, okay, we need to escalate to a higher level. Here is my first thing. Signs of PTSD, that we need to get a specialist involved. And usually, for me, even just a gut feeling, I am out of my zone. I just really rely. I have a good relationship with my gut, and just like, nope, I'm out of my zone.
Yeah.
Definitely, for practitioners who are new in the field, when safety comes up, unfortunately or fortunately, I've worked with enough clients who come in and say, I just want to die and be with my person. And I don't panic right away. I can hear that out, do my assessment at the end and understand where they're at. But I when my gut says, no, you're not the right person, there's something different here that's needed, I listen to that. And so I just encourage anyone to develop that relationship with their gut of, and get consultation.
Yeah.
Another EFT professional, like, am I in
I love actually that line that you just said, because there's always shades of gray.
Yeah.
One person says, I just want to die and be with them, and it's emotionally intense moment. It is what they're experiencing in the moment, but it's not necessarily that they have a true, and somebody else can be in a very, very different place. And being able to ask skillful questions and explore that with them to find out whether this is the right place for them is so incredibly critical for the well-being of both parties.
Yes.
Well, and one other aspect occurs to me too, and that's that do you have unresolved grief work? Is your own unresolved grief work going to get in the way of your working with this client? Either because it's a similar type of grief,
Yes.
or
Beautiful. I didn't think of putting that on there. That is great. Is this pushing your buttons? And your excellent. Yes.
Yeah.
Yeah.
This has been really, really helpful and enlightening. So thank you. I want to ask for those people, of course, that want to take it deeper, that want to know more, that are called to this.
Wait,
I'm
Craig,
just wondering.
can we do one more quick question, please?
I can go a couple minutes over.
I think we've sort of answered it, but what is the importance of having an other person facilitating grief work healing as opposed to you trying to do it yourself?
So when you're in this much pain and your emotions are dysregulated, you're overwhelmed. And it's so easy to get lost. And to have somebody say, hey, this way, let me guide you. The thing I say to my clients all of the time is, you are driving this bus. That is my line. You are driving this bus. I am sitting in the seat here and I'm providing you with options. And so, but I've driven on this road before. And so I know the terrain. And so when you're the other, you know the terrain, your client is empowered. You should always be empowering your client to do their work. You should never be working harder than your client. It took me a while to learn that. A little too long sometimes. Never working harder than your client. But when they're in a lot of pain, and knowing that, you can ask the questions and you can provide the guidance. And when you see them slipping, you can give that extra hand, I think is really powerful, rather than, when you're, I've been lost before and somebody else gave me that hand. And so when you get to be that other and give that hand, I think is a pretty, a great experience.
I like your metaphor of the bus driver who's driven the road before. Thank you.
Yeah.
Craig.
Yeah. So just getting back to people that are interested in whether people are dealing with their own grief or wanting to become more skillful in working with others, what might be some resources that you have or would like to offer or let people know about?
Yeah. So I'm in the middle of starting some new things, and one is a continuing education program, which actually you don't have to take for continuing education, but I'm launching some professional education in grief. I be starting a general grief course, and then with some specialty workshops. And if you're interested in that, do I just give an email address, or what's the best thing? Or
you decide how you would like people to contact you.
I'll just do my email, because my website, the sign up won't be up for about a month. But if you're interested in that, you can email.
Why don't you give both? Because the timing of when they watch this interview, your website might have everything updated by then. So why don't you just give both?
Okay. So I'm going to give you two sets of information for that. So my email is Jennifer, JENNIFER, at Therapy Heals, THERAPY, Heals, HEALS.com. And then my website is therapyheals.com. And then if you have experienced a sudden death and are interested in an online course, that would be at my website, fromgrieftogrowth.com. And if you have any general questions, you're welcome to email me at jennifer@therapyheals.com. So
awesome. Thank you so much.
Thank you.
And then just lastly, to just remind people, we're blessed to have people like Jennifer and so many others that interviews that we've gotten to do every single year for the last 10 years. It's really been quite broad and delightful, and you can find those on the website of tappingoutoftrauma.com for our past interviews. But we just also want to mention our upcoming cohort is coming up starting March 5th. And the Tapping Out of Trauma is that 8-week online course, which is a hybrid course of both pre-recorded modules and live modules, and online forum, and that's moderated by Suzanne and myself. And it's a very rich, intense course for the EFT practitioner that has a beginning insight into trauma, but is really working to be a more skillful trauma-informed practitioner. So again, just tappingoutoftrauma.com, and you'll see the registration for starting on March 5th. And any information you have there, you can check out the FAQs on that as well. So we just want to thank everybody that took the time, whether live today or following up, to check in with this and learn. Suzanne, did you want to add something?
Yeah, well, I just want to ask Jennifer one more question. Do you work online at all, or is it only in person?
All online.
Oh, okay, there we go. So just for folks to know. Yeah, and yes, thank you so much. This has been very rich and wonderful, and we thank you so much for joining us.
Oh, thank you for having me. It's been my pleasure. It's been
I
wonderful.
just know that this is going to be a topic that many people are going to be really happy to be more informed about. Thank you.
Thank you.